the Maria Holder Diabetes Center.
Lifestyle changes can be just as powerful as medication in controlling diabetes.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
It's time for 15 diabetic friendly minutes on 100.7 QFM, all with the compliments of the Barbados Diabetes Foundation, the Barbados Diabetic Eye Screening Program, and the Maria Holder Diabetes Center. Good afternoon to all the Q family who are listening. It's me, Peter the Boys, and we've made it through all the rain and flooding that I had all weekend long, and we only have just two more weeks of celebrating 59 years of Barbados independence in the month of November. And it's a double whammy of celebrations because it's also Diabetes Awareness Month. And last week, Friday, November the 14th, was Diabetes Awareness Day. You didn't know that? So, of course, the Maria Holder Diabetes Center, located in Warren, St. Michael, has been a big part of activities for Diabetes Month. And you're going to be hearing about some of them on this show. So, we are starting right off with a message from General Manager Marsha White that was released specially for Diabetes Awareness Day. Afternoon, Marsha.
Hello, everyone. My name is Marsha White, and I'm the General Manager here at the Barbados Diabetes Foundation. Today, as we celebrate World Diabetes Day 2025, I have a message for you. Get screened. In today's world of high stress, poor sleep, a sedentary lifestyle, convenience foods, and sugary beverages, we are all susceptible to type 2 diabetes, and we're even seeing an increase in type 1 diabetes. Now, it's one thing if you have been screened and you know that you're living with diabetes. You can be managing it, hopefully with your doctor, changing your habits, taking medication, whatever you need to do to fight it, and in some cases even reverse type 2 diabetes. But if you don't know, you don't know, and you could be sitting on a time bomb, because if left unmanaged, uncontrolled diabetes can lead to a host of other complications that in most cases are irreversible. Things like chronic kidney disease, hypertension, cardiovascular disease, certain cancers, vision issues that can often lead to blindness, vascular issues that can often lead to an amputation. Even dementia and Alzheimer's are related to uncontrolled diabetes. So please go get screened. Do that for yourself today or sometime before the end of November, which is Diabetes Awareness Month all month. You can go to your doctor, go to your polyclinic, come in and see us at the Maria Holder Diabetes Center for the Caribbean. Our number is 417-0305. Call and make your appointment today.
Thank you, Marsha. I hope the people on QFM hear what Marsha say. Repeat that last part, Marsha, for the people in the back.
Call and make your appointment today.
Make that appointment today to get yourself screened for diabetes, because you might have it and not know it. And the number to call, what's that number again, Marsha?
417-0305.
Right, so call today. As we go on to our next Q topic, the Maria Holder Diabetes Center was part of the Republic Bank Health event, which took place in Golden Square, Bridgetown on Saturday, the 15th of November. They had a lot of rain, but it still came off. Where you didn't go? Well, I made it through the rain, and I had this on-location interview with Dr. D. I'm here live in Golden Square with Dr. Diane Brathwaite, and this is the Republic Bank Health Fair. How are things going here today, Dr. Diane?
Things are actually going really good. I am just I came a bit late because of some traffic, but I'm so hyped to see the energy out here. And I think we should be doing more things like this in Barbados. It always just takes you to start something, but the exercise sessions have been great. There are stalls around where you can get your blood sugar checked, your cholesterol cholesterol. We at the Diabetes Foundation, we even have a foot stall where we're examining and screening people's feet down in the back and advising them maybe a little bit on what treatment they might need if they need treatment.
That's free.
And that is totally free, yeah. So that's our give back to Barbados for Diabetes Month, for Independence, and we just here having fun.
So how do you find Diabetes Awareness Month going on Diabetes Awareness Day? Have you achieved your objective of raising awareness?
I would say that my perspective on it is that raising awareness is a lifelong process for me, and I understand that because this is my job, my vocation, what I do. But yes, we have raised more awareness. We had a really good stakeholder meeting, and that was good. But I'm always interested in what can be done, right? So this is a good effort, and this is not just about raising awareness. It's about getting other ideas as to how you can tackle the epidemic in a very positive way. Because there's a lot of darkness and a lot of myth around NCDs and diabetes. But what we want to do is I want to empower people positively. I don't want all that negativity. You understand? So make people proactive doers with positivity, and that will give people that kind of urge to be consistent and achieve things. You see? So I would say yes, we have to some extent. I'm hoping we'll get a few more people in the little bit of time we have left here. But what I would like to see is to find a format where we can keep doing some of these things regularly.
Thank you, Dr. Diane Brathwaite, for working assiduously with the Maria Holder Diabetes Center and Republic Bank to spread the message of diabetes and keep Barbados healthy. And in case you listening to QFM was wondering, so what's happening for the month of November that I could participate in? Up comes marketing assistant Hillary Ford.
In the month of November, we make ourselves an extremely busy bee as an organization. Thursday, we'll be at BARP's headquarters in Hastings. That will be every Thursday between the hours of 9 to 2. We'll be offering diabetes screening, diabetic foot screening, and eye screening services. So if anybody is on their way to BARP, they could come in, they could walk in, or they can book an appointment to be seen on time. Every Thursday in November, we will be at BARP. This is the third year we'll be doing it, actually. We're also going to be participating in the nation's Fanathlon, and that is November 23rd. So we make ourselves very visible to the community in November.
Thank you, Hillary. So you got that, cue people? Let me recap. Every Thursday in November, Diabetes Foundation is at the BARP office at Hastings from 9 a.m. to 2 p.m. So you have ample time on your way to queue in the community tomorrow to stop in and get a diabetes screening. And the Diabetes Foundation is also in the nation's Fanathlon, which is taking place this Sunday, the 23rd of November. That is my son's birthday, so he could probably go to that. So Q family, come out and support. Good. Dr. Diane Brathwaite is back, and she has something else to tell you. Speak, Dr. D.
On the 14th of November, we commemorated World Diabetes Day. On Barbados, like the rest of the Caribbean and many other places in the world, for the month of November, we consider it to be Diabetes Month, where we like to raise awareness about all things pre-diabetes and diabetes, from areas of prevention to management to screening, and the list goes on and on. There will be, and there have been, a number of sources of information all across social media, so do not miss the opportunity to go and learn something more about this very common and prevalent condition in Barbados. The theme for 2025 was diabetes across life stages. Diabetes is affecting more and more people of all ages in all countries. So type 2 diabetes in particular is no longer something that older people get. It's something that concerns all of us. Rates of type 1 diabetes and other rare forms of diabetes are also on the increase. And the reality is, a lot of these things are being environmentally driven. And environmentally driven means lifestyles and environments which do not support healthier choices. I want to encourage persons living with diabetes that you don't have to survive with diabetes, but you can thrive with diabetes. And what does thriving mean, or what does thriving look like? Thriving means that you can exist with a diagnosis of diabetes, not constantly in a state of stress or expecting the worst for yourself. But there are some things that you're going to have to do that. Well, first of all, as mentioned previously, you need to get screened for diabetes. If you pick it up early, type 2 diabetes, obviously, you are at a higher chance of putting it into remission. And remember, remission is exactly what it says, remission. So that means that you have to continue to live a lifestyle after remission that allows you to possibly keep the diabetes at bay. But you will always be at a slightly higher risk of it having its onset in later years again. If you have risk factors for diabetes, such as a strong family history, you may need to get tested before then. Or if your mother had gestational diabetes, you may even need to get tested during childhood. So you need to know your risk first of all, and you need to know when you have to get tested and how often you have to get tested. We discuss these things all year, and hopefully you've been tuning into us. If this is the first time you're hearing us, please make sure you follow our program. We at the Barbados Diabetes Foundation, we remain committed to helping all persons in Barbados live healthier lives, prevent diabetes if they don't have it, and if you are living with diabetes, to encourage you to take care of yourself so you can live your best life possible at every stage of your life. Remember, there is support out there, and support looks like many things, but what we want really is we want to see Bajans taking back their health. We want to see communities as the drivers of health, messaging that's accurate and really empowering each other in the community. Together, we can do this.
Thank you, Dr. Diane Brathwaite, for the second time around, taking us right into our Q music break as we celebrate 59 years of independence and Diabetes Month. And we are proud to be Bajans as we go to this proud song from our own Desmond Weeks. Proud to be a Bajan. Compliments the Maria Holder Diabetes Center.
When I wake up in the morning and I look around and see the bees and the birds that sing so sweet.
The Maria Holder Diabetes Center.
I breathe the sunshine and the sea. My God, give them to me for free. Oh, let me hear you shout it. I'm so proud to be a Bajan. Let me hear you. I'm so proud of this great land. To the east and he is brave and yeah. Cause I know that he is with me all the way. Now respect to Sagari, Earl Darcy and Suki, who wrote our names on history's page. Yes, Obadeli, Rihanna and Ryan too. I always will be proud of you. I'm so proud to be a Bajan.
The Maria Holder Diabetes Center.
I'm so proud of this great life. To the east side, he is brave and king of everything. Cause I know that he is with me all the way.
We now go to a lady who has experienced the Barbados eye screening program.
Well, I found the service is very good, and I would advise anyone who is a diabetic, give it a try because it definitely do work. Want to follow the plan and you follow what you're supposed to do, yes, it can improve your eyesight, and yes, it do work. It can work for you. It is very extremely helpful because, as I said, when they first went into the plan, yes, they saw your doctor, but they didn't only just stop there on concentrating on the eyes. I had a nutritionist that taught me the right way to eat, a physical therapist. I also was taught, as I said, the right way to eat, the portions that you do put on your plate is very important, and there was a chart that was given for me to follow. They just didn't tell me. They also give me documentation. I had pamphlet, everything that I cannot follow, so I wouldn't get off track or go astray and do my own thing.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care.
Even without symptoms, uncontrolled blood pressure can damage your organs.
The Maria Holder Diabetes Center.